The fishbone diagram identifies and categorizes potential root causes for a particular problem. Based on the case study of neonatal respiratory distress, the diagram focuses on 4 factors which may have affected the patient outcome. These factors include maternal, delivery-related, neonatal, and environmental factors. Within each factor are subcategories that provide more detail into the effects of the problem. Number 1, maternal factors. Hypertensive disorders, including elevated blood pressure and headache, indicate possible preeclampsia. Intrapartum events. Meconium-stained amniotic fluid could lead to meconium aspiration. And placental insufficiency. This could cause fetal hypoxia during labor. Number 2, delivery-related factors. Cold stress after birth. Early bathing led to hypothermia, contributing to respiratory symptoms. Bathing a newborn too soon after delivery can result in significant heat loss because their thermoregulation mechanisms are immature. Hypothermia can lead to vasoconstriction, causing cyanosis, increased metabolic demand, exacerbating respiratory distress, or hypoglycemia, which can worsen overall stress. Delayed fluid clearance. Common in transient tachypnea of the newborn, or TTM, especially after stressful deliveries. Tachypnea and mild respiratory distress, including grunting and nostril flaring, are common symptoms. TTN is typically self-limiting, but can be worsened by additional stressors like cold exposure. Number 3, neonatal factors. Immaturity of lungs. Even at term, surfactant deficiency could lead to respiratory distress syndrome. Hypoglycemia. Increased metabolic demand due to cold stress or birth-related factors. Infection/sepsis. Though blood work was considered negative, infection remains a consideration in neonatal distress. If there were breaches in sterile technique during or after delivery, the baby could develop early onset neonatal sepsis, which may present with respiratory distress. Number 4, environmental factors. Suboptimal thermal regulation. If a bath was given too early, it could lead to cold stress. Oxygen delivery challenges. Possible delayed initiation of oxygen therapy during distress.